Good afternoon. My name is Dr. Petrikovsky. I'm professor of obstetrics and gynecology. I'm board certified in obstetrics and gynecology and also in maternal fetal medicine. Upon request of numerous patients and colleagues, I would like to give this presentation on coronavirus and pregnancy. First of all, I would like to make a disclaimer. I've never seen a pregnant patient with coronavirus, and I'm not an expert in coronavirus in general. But I want also to give you a second disclaimer. I'm unaware of anybody who in the United States of America saw a pregnant patient with coronavirus, and because it's a relatively new entity, I am unaware of any experts in the field. So I feel comfortable to share what I know about it as well as anybody else in the country. Well, first of all, very briefly, I want to tell you that coronavirus is a large RNA virus that now really is considered a pandemic. It's seen in almost every country. What I would like to do first is, and I obviously use visual aids because it's relatively new entity and we'll all sort of discover it, both doctors and patients. Regarding other viruses that have been seen recently, I would like to start with the so-called bird flu virus that was identified in 1997, was seen in 18 countries, and the mortality rate was, in those people who were affected, was over 40%. Very, very high mortality. Atypical pneumonia that was first identified in 2002, so-called SARS, was seen in 29 countries with a mortality close to 10%. The swine flu was first identified in 2009, affected 216 countries, and has relatively low mortality rate of less than 1%. So compared to this, coronavirus is currently pandemic. It's seen and detected, identified in almost every country. And the mortality rate is between 1 and 2%. In actuality, probably mortality rate is lower than that because there is a large amount of patients who were affected by coronavirus in a relatively mild form. It was never registered. They never went for medical care, and therefore they're unaccounted for. My next step, what I would like to do with you is, prior to talking about coronavirus and pregnancy, is to talk about other viruses, because as an expert in maternal fetal medicine, I've definitely took care of many patients over 40 years lifespan as a physician with various viruses, including Zika virus that I've seen because I'm licensed in Florida. I see patients in Florida as well as in New York. Measles virus, HIV virus, and many, many others. Coronavirus is a little different though. So talking about measles, the measles virus, I just want to give you a very brief overview. It can stay on the surfaces for a couple of weeks. It can also be in the air for about 48 hours and is highly contagious. The hepatitis virus, hepatitis B, that we see in many patients, can survive in blood under room temperature up to 3 months. In the dry plasma, up to 25 years. And obviously, hepatitis virus can remain active, even exposed to 80% alcohol. Now, not similar, but quite as common, the flu virus, which we see a lot during flu seasons all over the world, can survive in the air from 2 to 9 hours, can survive on the human hand up to 5 minutes, can still be detected on plastic, on metal surfaces for 24 to 48 hours. Actually, it's pretty resistant to cold. In the refrigerator, can still be alive up to 7 days, and can actually exist and survive on tissue, towels, up to 11 days. Flu virus is relatively sensitive to temperature and usually die when the temperature goes about 60 degrees centigrade. Flu virus occasionally in pregnant patients is associated with a viral pneumonia. I've seen a couple of such cases and managed a couple of such cases as a director of maternal fetal medicine in the hospital setting, and they're really quite severe. Now, as far as current coronavirus is concerned, it stays on surfaces with the humidity up to 40% and temperature up to 22% from a couple of hours to 5 days. It's very sensitive to alcohol and also die within 15 minutes when the temperature goes above 52 degrees centigrade. Now, those are the data regarding the current flu virus infection. Now, what I would like to show you, and this is well known, is just for the sake of completeness of the talk, are the symptoms of coronavirus infection. And you can see it's usually fever, malaise, tiredness, cough, breathing difficulties, and muscle pain. Those are the main symptoms that were detected by infectious disease specialists as the sign of the coronavirus. Now, many of those symptoms are non-specific. A lot of cases of cough, fever, muscle pain may be unrelated to coronavirus. And in recent briefing of the special group that is in charge of handling the current epidemic, stated that over 90% of people with some of those symptoms were tested negative for coronavirus, which means not every case of muscle pain, headache, etc. are necessarily related to this particular infection. The next thing I would like to do is, before I go to the specific topic of pregnancy, to address the current recommendation that I'm sure you heard all over the place from various experts and healthcare providers, what needs to be done. Well, first of all, it's very clear that hands needs to be clean and hands needs to be washed. They say for a certain amount of time, over 20 seconds, on the regular intervals. People need to create habits and remind themselves to avoid touching their face, and obviously, especially when after coughing or sneezing, they need to disinfect surfaces like doorknobs, tables, handrails, etc. What's very important is to increase ventilation by opening windows and adjusting air conditioning. And those are the things that needs to be done. Now, if somebody is sick in the family, what the recommendation currently are that the sick members stay in their own room if possible, and keep the door closed. Preferably have one family member taking care of the sick to decrease spreading of the virus. And those are common sense, but very, very important recommendation. It's very important to stress, and people talk about it all the time, that bad outcomes that brings patients to the hospital and put patients on the respirators are mostly for people with pre-existing condition, especially respiratory problems, asthma, pulmonary obstructive disease, tuberculosis, and decreased immune system. Now, we'll talk a little bit regarding pregnancy and coronavirus. And here, by the way, there's very little data, but the news that we got are relatively good news. I can actually cite only one publication that came from China that analyzed the clinical characteristics of coronavirus in 9 pregnant women, confirmed by coronavirus testing. They did pretty extensive, although the number of patients is low, nine women, but they did pretty extensive study. They look at the amniotic fluid, they tested the babies, and the outcome were favorable, meaning they did not detect any viral particles and was tested negatively for amniotic fluid. The babies tested negatively, placentas as well tested negatively, which is actually very good news, which means at least as much as we know now, coronavirus does not have vertical intrauterine transmission. By the way, unlike other viruses, such as HIV. So women who are affected by coronavirus, at least at the time of our knowledge today, don't expect to transmit virus through the amniotic fluid or by bloodstream to their babies. So it's relatively safe. They also didn't detect any coronavirus particles in the breast milk. Therefore, at this point, we cannot recommend not to breastfeed babies like we do with other viruses, with some of the other viruses, thinking that babies can get affected. As a matter of fact, the particular virus, coronavirus, has very interesting preference. The ratio of male to female as far as infection favors males, and children for the most are spared from being infected, although it's very hard to control children's behavior as far as washing hands, not shaking hands, not touching each other. So if coronavirus would affect children as much as adults, we'll definitely see many more infections among children. And so far, we don't see it. Now, in summary, I just prepared this slide that I think is very important. I don't know if you can see it well. That summarize the topic of my presentation, which is coronavirus and pregnancy. First of all, which is very important, there is very limited data at this time. Most data is coming from China. Number 2, there is no evidence that shows that fetus is more susceptible to coronavirus. There's also no evidence that coronavirus can spread to the fetus. And it's really interesting because pregnant women are traditionally considered as patients with decreased or depressed immune system. And coronavirus is more dangerous for people with decreased immunity. But somehow, based on our experience today, there is no evidence on the negative effect of coronavirus in pregnant women. I thank you for your attention, and if we get more data, we'll definitely update you on what goes on the topic. Thank you.